Thank you very much for coming. We called this press conference on short notice because we really have to raise the alarm about a situation that's unfolding right here in the Cleveland area. We've had a number of these press conferences talking about the heroin crisis. It is not going away. And in particular, with this drug, which is being used as kind of a substitute, so to speak, for heroin, which is called fentanyl, we have to let people know. And we just have to ask the media to spread the word about this as much as possible. I mean, the people are dropping dead constantly on a weekly basis because of the use of this drug. It's about the most addictive and deadly thing that's out there. And so I had a conversation earlier today. I mean, we just put out a notice about this yesterday, about how bad it was, and we got some coverage about it, but I was talking to Prosecutor McGinney today, and we said, we have got to just keep sounding the alarm as often and as loud as we possibly can. I can't remember a drug-related situation that even compares to this in recent time. Let me tell you what specifically what we're talking about. We're talking about something called fentanyl. You'll hear more about it. It's a very powerful opiate. A single dose can be up to 25 times more potent than heroin, and heroin is already potent enough as it is. It's being used by some heroin dealers, and these guys are murderers as far as I'm concerned, and they're using fentanyl as a substitute. They're mixing it with other drugs in different ways, and it's completely Russian roulette for the user. More people are going to die about this unless we get the word out about it. Since November 13th, our medical examiner's office, led by Dr. Gilson, has confirmed 12 deaths linked to the use of fentanyl and another 12 non-fatal doses. Some people that came very close to the line of dying. That's just in the less than the last month. We're talking about in the last 3 weeks or so. So the weekend is coming up. There's going to be people that, if they don't get the word, are going to be using this drug today, tomorrow, this weekend. And we've got to have a determination by everybody involved. That means the county government, the prosecutor's office, the medical examiner's office, law enforcement. You're going to hear from some folks from the city, some of our suburbs. This is affecting suburban communities. This is not an inner city problem. If anybody who hears this has some kind of idea that this is some kind of urban inner city problem, throw that idea away, because this is crossing all kinds of demographic lines and geographic lines, and you'll see that by the map that we have on the wall here. So there's no age group, there's no suburb that is immune from this. So we've got to just keep pressing this issue as much as we possibly can. We've got to have a collaborative approach that involves everybody in the community before we have more funerals that are going to happen as a result. At this time, I want to turn it over to my colleague, our County Prosecutor, Tim McGinney. Tim?
Thanks, Ed. Ladies and gentlemen, this is a public health crisis. This is the worst we've ever seen. There are more people dying faster than ever before. We had 12 deaths and an equal number of confirmed non-fatal overdoses from fentanyl in the past 3 weeks, and it's spiking now. There are some other deaths yesterday that may turn out to be fentanyl-related too. I want to thank Dr. Gilson and his staff who do the hard work here and doing the examining, and the police officers across this county and police departments who follow up on these deaths. We want to alert the public of an epidemic. If this were Ebola, we'd be in a total panic in the city. What we have here is more deaths than we've ever seen before, and a great deal of danger. Someone is poisoning the drug-addicted people in Cleveland right now and killing them. They're selling this as heroin. They're not buying fentanyl, to their knowledge, and they think they're buying heroin and they're dying from it. We expect, if this continues, this pattern, many more deaths, and we want to warn the drug users and their families to be on the alert. Since the beginning of the year, we've brought 10 prosecutions for manslaughter charges, stemming from heroin or fentanyl. We're investigating others, and we plan to pursue homicide charges and overdose deaths whenever the facts allow. I'm going to ask two people to speak here for Dr. Gilson. We've got a great medical examiner who is tracking these deaths, looking for patterns, looking for information, and he can educate us as to the dangers of the drugs. And I've asked Commander Gilson from Cleveland to come. He's extremely busy, as is Police Chief Malley from Lakewood to come, to give us some personal experiences to give you an idea of what havoc this drug has caused in our community. And you can see from this mapping that and some of the information that the deaths range from teenagers to a 62-year-old individual. And yesterday's, I think last night was a 57-year-old man. It's across the board. It's very sad, and it involves 7 different communities so far, and there'll be many more. Law enforcement is working diligently, but we felt duty-bound to present a warning to the public, and in particular the drug addicted and their families, because many more will die if the word doesn't get out there. So we thank the media for helping spread the alert on this stuff that's being sold as heroin, and it's in fact fentanyl. Excuse me, Dr. Gilson, thank you. Thank you.
Good afternoon. I know this may seem like a broken record, and we're here every couple weeks to talk about drugs, but this is not just the same old, same old. As the executive mentioned, when we had the year follow-up for the summit on the 21st of November, we made an alert about the drug fentanyl being the result of a couple people dying. That was the first 2 deaths that we saw, which, if you look at this map, were clustered in a single area. Anytime fentanyl is detected, it's a source for tremendous concern because it is so much more potent than heroin. The executive mentioned 25 times more potent. That's a fair estimation. And it tends to do things like what we're seeing now, which is to really produce a tremendous upswing in the number of overdose deaths that occur in a community. If you remember, in March, we had a situation where fentanyl was identified in our community and 3 people died. And to be honest, we got off very easy there, largely through the efforts of partners in law enforcement. And I'd be very remiss if I didn't acknowledge the laboratory here in the medical examiner's office, some of the folks here at the back of the room, because in honesty, we are doing everything we can to identify this drug and get it confirmed as rapidly as we can, get the information back to law enforcement so that they can try to identify sources so that those folks can be shut down. But the truth is that even the best efforts will unfortunately fall short, and we have to keep putting this alert out. And I thank you for showing up today to help us get that message out. 12 deaths in this short time period related to fentanyl is an alarming statistic. We don't have a lot of fentanyl deaths. This drug is very, very prevalent in the southern part of our state. It's prevalent in other places around us, but we've been very energetic to try to keep this drug off the streets of Cleveland because it has such a terrible effect with mortality. The map that you see here, I think, reinforces a couple of things that are just true, and I want to disavow anybody of the mistaken impression that they can use drugs safely. It's not confined to the city of Cleveland. Some of these deaths are out in the suburbs, some are in the city of Cleveland. It's men, it's women, it's not kids. Our youngest death was somebody in their 20s, our oldest was somebody 62 years old. There's nothing selective about how this drug is affecting our community. Some practical things I can mention that may help people not come to this office and have me give their loved one a call and a conversation I certainly just hate to have over and over again, but I've had way too many times over the last few years. If you don't use drugs, don't start. These are addictive drugs. I don't think people intend to wind up addicted to them. If you have that choice, don't experiment with these. Don't trust somebody to tell you that this is safe. There is no safe drug. There is no safe dose of these illicit drugs. There's no quality control person. These are people who want to make money, and they are unwilling to take anybody's well-being into their consideration except their own and their profit. If you are no longer able to make that choice, whether or not you're going to use drugs, seek treatment. Treatment does work. Be persistent. You may not, we know that there are issues around treatment, and that's something that we're trying to address, but seek the treatment. Stop using the drugs if you can. I can't endorse the use of drugs, but if that's not something you have a choice with anymore, there's a couple of things that can reduce people's potential to fatally overdose. Don't use drugs by yourself. Nobody's there to help you if you overdose. And as I said, fentanyl is so much more potent than heroin that you're not going to be able to save yourself. You're not going to have a warning sign that I better call 911. Somebody else is going to have to do that for you. If you're with somebody who's getting into trouble and you're using drugs, call 911. Save their life. I also have to mention, too, that the antidote for heroin, naloxone, which Project Dawn has been distributing now for about 1.5 years, is effective against fentanyl as well. If you're choosing to use drugs, have that available. Have your family make that available, too. Seconds count, and if you're waiting for EMS potentially to show up, you may have lost your chance to save your life. I'm disheartened by this map because I think a lot of the people here behind me have made tremendous efforts to work on our drug problem here. I still believe firmly that communities solve problems locally and that we have the team in place to get ahead of this, but we have to get the word out to people that this is a new wrinkle and it's very, very dangerous. And there is no way for, one last point, there is no way for somebody to say to you, this is heroin and not fentanyl. They look alike. They're not distinguishable because somebody says that to you. Don't use these drugs. Thank you.
Chief, you begin. Thank you.
Chief Tim Malley from Lakewood PD. I want to give you just a little bit of idea of what we're seeing out in a city like Lakewood. In Lakewood, we responded through yesterday, through 48 overdoses in the year of 2014. The last 5 weeks, we've had 11 overdoses. And out of those 11 overdoses, we've seen 4 deaths come from that. So we're being hit very hard, very quick by the fentanyl that's hit the street. For the year, we have, out of those 48 overdoses, I think we have 12 deaths in Lakewood itself. So when we get an overdose report, 25% of those people are dying in our city. And it really is tragic, and it really is unacceptable. These are things that generally happen behind doors. You don't see them out in the public. You don't see them in your parks or anything. It's something that is out of the general view of the public. But believe me, it's a very big problem in a city like ours and all throughout the county. Dr. Gilson made mention of Narcan. In these 11 overdoses, we've used Narcan 3 times to bring 3 people back to life, to save them from dying. I mean, it's a great tool for us to be able to use, and it's proven that it does save lives. And so we continue to, all of our officers carry it. We'll continue to carry it, and it's very important that the families of people that are addicted to heroin have the ability to get the Narcan as well, to have that available. We had a couple cases in the past couple days of double overdoses. So people that are taking it together both overdosed. And so, they're getting the same fentanyl from the same person. Overdosing, one guy died, and the other, his brother lived, was brought back with Narcan. Otherwise, that family would have had a double fatality. So at this point, with the problem we're seeing with fentanyl, I think what we're talking about is suicide prevention, really, for everybody out there. They need to get the information that they don't know what they're taking, and it is just killing people. And we need to figure out the ways to get that to get off our streets. So, thank you.
Thanks, Chief Malley. I'd also like to thank Mayor Summer from Lakewood. Mayor, you had the courage to face this issue. This is a significant issue to your population in your city. And in the past, some cities have not wanted to acknowledge a problem. Some suburbs would want to pretend the problem isn't there. And Dr. Gilson and his staff who are tracking this carefully can tell us the exact number, but we are in a slight majority last time I looked to the suburbs for these overdoses and deaths. This is not a city of Cleveland problem alone. The majority is actually outside the city where a majority of the population is, frankly. And so, Mayor, if you had a word, I'd appreciate before we introduce Commander Gilson from Cleveland.
Well, in Lakewood, I'm very grateful for the county focus through the efforts of the U.S. Attorney's Office, Prosecutor McGinty, County Executive FitzGerald, Medical Examiner Gilson. We have a substantial amount of resources. Unfortunately, we're swimming upstream right now, but Lakewood, despite our substantial resources, is woefully inadequate for the job. But I'm very confident that the collective strength of all that we can bring to bear here will turn the tide eventually, but this is an important message today.
Thanks, Mayor. And finally, I'd like to introduce Commander Gilson from the Cleveland Police Department. There is nobody in this county who knows more about the drug problem or has fought the drug problem harder over the years than Commander Gilson. Please.
Thank you, Mr. Prosecutor. As the medical examiner said, we've had this issue before, but it was a more focused problem, localized to a near West Side area. The Sheriff's Office initiated a case the last time, and we all joined in and we were able to stop it pretty quick. In this particular instance, though, we got our warning from actually West Shore Enforcement Bureau about some incidents in Lakewood, in Lorraine. And we initiated our alert right then. I talked with Hugh Shannon from the medical examiner's office, and we put our alert into effect. We ramped up our efforts at CPD. Generally, what we do is we go out and investigate when a death occurs. The medical examiner will call us. What we did to ramp up the efforts was anytime there's a non-fatal OD, we send our investigators out now. And as a result, we've made several arrests. We've got several other investigations going, but the issue here is that it's not just in one region, one little area. It's widespread. We've connected it to Medina County, obviously Cuyahoga County, Lorain County, and other parts of the state. So everybody's pitching in, and I can't say enough, like the doctor said, about the people who do the testing for us. The process that usually would take days takes hours. So our investigators are able to move on good information. So we really appreciate that. And Prosecutor McGinty sends a prosecutor out to the death scene to start their investigation right away too. So does anybody have any questions? Thank you.
Thanks, everybody. We appreciate it. We felt it's our duty to inform the public. It's our duty to inform even the drug users about this. Other people are going to die. The more information they have, the more intelligently they can act. And as Dr. Gilson has stated, it's do not believe your drug dealer. You cannot put your trust. This is not a pharmacist. You cannot trust what they're selling you. And if they're selling you fentanyl, you don't know it until it's too late. You're dead. Thank you.